Another doctor takes her life in the top medical college of the country. An intern of the Safdarjung Medical College, Delhi, hanged herself in the room on the night of the 31st August. I believe it's a high time we should all sit and figure out what's wrong with our system and, more importantly, how to prevent this. The stressful life of a doctor, especially interns and the residents, really needs to be addressed. Otherwise, we will keep losing gems like this every day. I sincerely hope we figure out how to improve the mental health of our young doctors before it's too late. As a career, medicine is long, painful grind, and the system offers no empathy to the students who take time to adapt. Life is harder for medicos than even for the soldier, perhaps.
हम भी पेले गए थे तुम भी पेले जाओगे
Internship is a thankless job. Medical interns are grinded in the worst way possible, and this is being normalized day by day in almost all colleges across the country. And 24-hour shift is considered to be normal stuff here. And not only these are the working hours that are exhaustive, but you won't be paid adequately to meet your basic daily needs of your life. It sounds certain kind of joke here. Hello everyone, my name is Dr. Manjeet Singh and you are watching The Medical Element. When a student completes his graduation, his age at that time is around 24 years to 25 years. His counterparts of his age who are in a non-medical background are enjoying a very good package and they would be having a personal life which would also having the peace. But as we certainly don't own any kind of personal life, it's pointless at any point to talk about this at all. A doctor during the internship is at such a stage that they have to depend on their parents to even to pay their mess bills because the salary is too low to survive, and that too they have to wait for the months. What can be worse than this? Medical interns are most prone to exploitation. If you'll ask me personally, I haven't been paid since months, and we are asked to reach duties without a delay of even a single minute, and the extra hours goes uncounted. Faculty members who threaten interns by saying that they will mark absent on every petty thing and try to prove a point of superiority but go silent when it's time to take a stand for them and discuss the basic issues with the administration. An intern of a private medical college seems to completely lack the concept of the salary during internship post MBBS, and all they wish is to move back to their homes after spending crores of rupees on their training and their education during the MBBS.
गुम का दौरा हो गया क्या साहब और निकालो निकालो मुझे यहाँ से निकालो मुझे यहाँ से
नहीं
And now the question rises that why the junior most are being sacrificed in our medical system and why they have to pay the price of the system failure. And the answer is love affair of the kings with the thrones, and it won't be appropriate for me to speak on this topic as I have been a weak player in this game since the beginning. So all I can say with this is, I'm sorry, Babu. Juniors, ethics, patients, these all affairs keep going on and on around the practice, but what matters on priority is the personal network and the connections. And according to an intern in the Gujarat, interns are at the most miserable place than nurses and the ward boys. They were there to bring the residents food only from the canteen to hostels up to 12 to 15 kilometers away and ordering their food from Zomato and Swiggy. He also wrote that if we refuse, then they threaten us by saying that they will make it worse. Now let's talk about the glorified peons and the bandit queens in the hospital, especially in the government hospital. Now if you live in this world and sometimes peep into the news, then you will remember the incident which happened a few days back in the AIIMS Delhi, India's topmost medical institute. Let me give you an overview. A male nurse misbehaved with the doctor and insulted him by saying the following quotes. And some of them were like, तुम तो स्टूडेंट हो, तुम्हारी औकात क्या है? कल का स्टूडेंट ऐसे आके खड़ा हो जाए, You are here for only 3 years. यहाँ नहीं बैठ सकता तू. अरे बाहर निकालो इसको.
निकलो बाहर निकालो इसको बाहर निकालो
This all went on record and finally news and media covered the story, which was later reacted by the Resident Doctor Association, which then made the headlines. I guess you would be surprised after listening to such incidences even happening today. But that's not the case with the intern doctor or the resident doctor here, as they have to listen all this stuff on the daily basis, and it had become their daily cup of tea. And when we don't turn back to react to this behavior, it have made them to turn even more worse, which gives a kind of confirmation, and it's really spoiling the situation. I regularly witness brilliant residents resigning from the top departments in the top institutes of India because they are unable to handle the toxicity. The same departments abroad have almost minimal attrition rates. The difference is because toxic cultures are not normalized there. Faculty make sure not to mess with the staff nurses and don't question them. Since they don't do that, interns end up doing everything the nurses are supposed to do. In the government medical colleges, and interns even administer the IV bottles as nurses instruct the student nurses to not to do it. Sampling in wards is completely done by the intern doctor, especially when posted in the general medicine or in the general surgery departments. But you would be surprised to know that government have appointed dedicated lab technicians for each and every ward, whose duty is also to draw the blood samples and do the further processing, because they are the person who are actually trained for this and handling of the samples. But most of us have not even noticed their presence in the ward, and the reason still remains a mystery.
मीटर
अबे चांद पे है मैं।
मुंबई वापस आने में थोड़ा टाइम लगेगा।
आप उधर क्या कर रहे हैं भाई? इधर मामला ठंडा हो रहा है, जल्दी वापस आने का करो भाई।
थोड़ा टाइम लगेगा।
कितना टाइम भाऊ?
Consequently, residents force intern to do this stuff rather than training the intern doctor about the subject and the department in which they are posted. Nothing specific clinical knowledge or any clinical skill is being shared in these departments. Overnight duties, 24 hours of just blood drawing, and useless tasks like collecting the blood bags or the reports from the counters and whatnot even makes the condition worse. Now, something more hurting is the OPD duties, where only job assigned is to make slips for the medicines and the investigations. A separate small cabin is provided where it's even tough to breathe, and the long queues make it worse, where they just have to copy the prescriptions on the another piece of paper. It's just like using doctors as a photocopying machines and nothing more. No clinical knowledge, no clinic examination, or no exposure to the clinical stuff. It's just pure labor and pure labor. So if you're thinking to pursue your dream as a doctor, or you want your child to pursue this career, be ready for let being yourself exploited in the worst way possible. Hospitals have enough number of paramedical staff appointed and under-trained paramedics to get the job done, but the chosen ones for the exploitation are the interns post MBBS. So much to reveal, but it's the gravity of the moment that doesn't allow me to disclose much. And all I can say again is I'm sorry, Babu. All you need to do is wait for this period to end, and I'll be back again. But till then, keep reminding me in the comment section. Do use the comment section and share your experiences in the internship and let others learn from these. Stipend received by the medical interns is so low that it does not justify the amount of the work they do. After all, this stipend is even delayed by months and months. A former student of the medical college in Uttar Pradesh, who don't want to be named, said, "We used to get paid rupees 5,000, but even this was not paid on time. We protested for a bit as the payments were delayed for 3 to 4 months. But the college said that they lacked the funds to pay on time, and the protest gradually stopped as it was pointless." Protesting against such practices is unthinkable for the students, as they usually met with the draconian measures. Another student confessed that कि अगर हम protest करेंगे तो authorities will not sign our logbooks, or they can even put a stay of the extra duties by giving the petty reasons. That only further wastes our time. Due to such threats, not many people raise their voice, and this practice continues to be. Those who wish to pursue their post-graduation even take a year off to prepare for their entrance exam, since studying during internship is almost as an unthinkable task. Except for those interns in a few states in the northern India where the doctor-to-patient ratio is satisfactory, medical interns in the rest of the country can barely catch their breath. The lack of the resident doctor in some of the medical colleges add to the workload of the interns. The ultimate goal of the MBBS student nowadays is to crack the NEET exam, which is a gateway to the post-graduation seats. Earlier, the student used to prepare for the entrance exam after the internship is over, but as the competition is increasing day by day, the students get attracted towards the coaching institutes. The condition is so worse that students go to these coaching institutes to read notes or the online study material from the beginning of the MBBS due to the increasing competition. In every medical college, you can find the MBBS students sitting in the library with their tablets running these lecture. And due to this, student-teacher interaction have significantly decreased. Faculty in these coaching institutes don't even have the one-tenth of the expertise if you compare to the expertise of the faculty of any government medical college. But all do they know is what is being asked in the NEET exam, and the whole training program on the patient based learning is ignored by the MBBS student. Yes, there are classes in the OPDs and in the wards, but all they prepare are the good case presenters. And this is developing the question solving mindset in the students rather than the diagnosis making mindset. So all we can conclude is that India is producing the graduates who have near zero knowledge of how to treat and deal with the actual patients. Word postings and OPD training involve the art of the communication, observing subtle signs, taking the patient into confidence, and then using the knowledge appropriately. What we are producing is the coach students who have no expertise are the most exploited ones in their professional and the personal life. Still, my raw piece of advice to my juniors who have just entered into the medical college or into the medical profession is always remember that you are always replaceable at work, but you are never replaceable at home or for your family. And according to me, the toughest job in this profession will be maintaining your own good mental health and sanity along with keeping peace at your heart. Be thankful to God as your hands are the chosen ones for the healing of the mankind on this earth. And my immense love for this profession, which changes life of the every human we touch, remains same. It's just a system failure that have exploited us on the stage. But my friends, hold on strong. No matter how tough are the times, but they will change. And to do a bit of your portion, do share this video if you agree to the things that we have discussed and let other people know about this. Let your parents, friends and family know how much pain you go through to earn this title of a doctor as a prefix in your name. Always hold it high and be the healing hands in the service of mankind. May God give us strength to bear it all. That's all for today, but don't forget to hit the subscribe button because we are all together into this. Thank you for watching the video and love to all.